Okay, we're going to go ahead and get started. Welcome to the third in a series of webinars on the Standardized Program Evaluation Protocol, otherwise known as the SPEP. Today the focus will be on service type categorization. My name is Heather Perry and I'm a Juvenile Justice System Improvement Specialist with the Evidence-Based Prevention and Intervention Support Center, otherwise known as the EPISCenter. We're a center that's funded by the Pennsylvania Commission on Crime and Delinquency and the Department of Public Welfare to provide training and technical assistance to the evidence-based programs and coalitions in the field, as well as support juvenile justice system improvement across Pennsylvania. We're a project of the Prevention Research Center, which is housed in the College of Health and Human Development here at the Pennsylvania State University. I'm going to be presenting the overview of what we're going to be covering today, and I'll also discuss the format of service type fact sheets and why they are valuable to us and will be for you as well. Lisa Fries, a Juvenile Justice System Improvement Specialist, will present an informative overview of the three broad service type categories, which include restorative, counseling, and skill building services. Lisa will discuss primary and supplementary services, as well as provide you with an explanation as to why certain services are not included yet in the fact sheets. She'll also discuss the SPEPing of blueprint and evidence-based programs. Sean Peck, also a Juvenile Justice System Improvement Specialist, will dive a little deeper into the service type categories and speak with specific detail on some services. Further, he'll provide you with things that we've experienced from the field. Finally, we'll wrap up with a question and answer session where Jeff Gregro, Berks County Deputy Chief Probation Officer, will expand on things that we've covered and answer questions from the viewers. We're very fortunate to have Jeff joining us today, as Berks County was the initial pilot county to roll out the SPEP process. Jeff has been a mentor to numerous folks across Pennsylvania, including us here at the EPISCenter, as we pilot SPEP in now 5 counties. Among many other responsibilities, Jeff is the co-chair of the SPEP Advisory Committee Work Group. So welcome, Jeff. At least one of the 4 of us have been a part of each and every SPEP conducted here in PA thus far. PA has conducted about 16 SPEPs in the 5 pilot counties, which include Allegheny, Berks, Bucks, Dauphin, and Lehigh County. So please feel free to type in your questions into the Q&A chat box, and we'll be sure to answer the questions at the end of the presentation. So let's go ahead and get started. As mentioned in the previous webinars, there are 3 key drivers in terms of effectiveness of programs to reduce recidivism. These 3 components are drivers behind SPEP. The focus today will be on service type, which we'll discuss in greater detail in a few minutes. Another aspect of effectiveness is the way in which probation utilizes the program. This could entail the level of risk of the youth referred to the program or the amount of time the youth is referred to participate in the program. The third and final key driver for effectiveness of programs to reduce recidivism is the provider delivery of that program or service. Provider delivery entails how the service is delivered to the youth. If you need a refresher on the latter 2, you can refer back to webinar 1 and 2, which are accessible through the EPISCenter website. The fact sheets were sent to you upon registration, and as you can see, they're available down below under web links. They're available for today's purposes there, and for in the future you can go to our website, which is also listed here on the screen. Fact sheets are important because they are the tools that certified SPEP staff utilize when they classify programs and unpack service types. Program classification entails matching your program or service type categories found in research. This applies only to therapeutic programs with a sufficient research base. Classification is based on detailed descriptions of the services provided. Service type categorization can be trickier than you might think. It takes a team of certified SPEP staff several hours of training to categorize correctly. Classifying requires an in-depth interview with probation and the provider, which entails much discussion and agreement across stakeholders. These stakeholders include the SPEPers, probation, and the provider. Sometimes it's very clear what the primary service type is, and other times it may take more time, investigation, and discussion to determine the best suited service type. If the service is not classified correctly, it could be held to a different standard. So we want to make sure that when we're there SPEPing your service, we classify it correctly. These fact sheets were developed based off of LIPSY's years of research. Research indicates there are 3 broad service types or general approaches that the service fits into, which these services could be restorative, counseling, or skill building. This can also be broken down even more, and the fact sheets list the service types and include details and descriptors differentiating each service from one another. The fact sheets also include at least one example of each service type from LIPSY's research. The SPEP score is driven by a service category group, which is indicated on the fact sheets. They're classified into 5 groups, and each group is assigned a different score based on the research. The fact sheet indicates if there's a qualifying supplementary service that enhances the primary service's likelihood to reduce recidivism if being utilized. And finally, the targets for the amounts of service are noted in weeks and hours here at the bottom of our fact sheets. So next, Lisa Fries will discuss service type.
Okay, thank you, Heather, and welcome everyone. If you're participating in this webinar, we're going to assume that you've been exposed to past presentations and webinars where the research behind SPEP was provided in detail, but we think it's important to discuss briefly the context of what services can benefit from the SPEP process before we give you specific information on the therapeutic service types. So we know the research behind SPEP, the meta-analysis that Dr. LIPSY and his colleagues at Vanderbilt University conducted, found that it was therapeutic services that were shown to have an effect on reduction of recidivism. Control-oriented approaches such as boot camps or scared straight types of deterrence programs can actually increase recidivism according to his research. At the time the meta-analysis was conducted, there was insufficient research available on services specific to special types of populations, such as drug and alcohol offenders or sexual offenders. However, Dr. LIPSY is currently looking at studies related to these specific populations, and as he gathers and reviews this research, it is expected that eventually the SPEP process can include such services. While there is no quote-unquote valid scoring for such services currently, we can still review these types of programs and offer recommendations with respect to quality measures examined through SPEP and the types of kids or risk levels of youth receiving the service. So with therapeutic services, we know there is evidence to show an effect on reducing recidivism. These services focus on sustained behavioral change in youth. And within therapeutic services, the SPEP categorizes these services into 3 broad approaches. This is a chart or grouping of the 3 broad approaches. They include restorative services, counseling, and skill building services, as Heather mentioned earlier. I'm going to explain each in a bit more detail and then bring this slide up again just to give you a better context. But essentially, the categories in the gray boxes are the service types within SPEP that we focus on after identifying the service approach as either restorative, counseling, or skill building when we're looking at determining service type. There are definitions for each, and once again, you can find this information on the fact sheets that Heather showed you earlier. Okay, restorative service types focus on repairing the harm caused by a youth's delinquent actions or behavior. They may require some compensation to victims, such as paying restitution or reparations by way of community service. They can also involve victim-offender reconciliation through a mediator or a mediation process. And second is counseling and its variants. This focus is on a personal relationship between youth and a responsible adult who attempts to influence or impact a juvenile's behaviors or feelings or thought process. Within counseling, there are 6 service types, as you see here. Mixed counseling on the bottom is a combination of 2 or more of the services that are listed above it. Now that brings us to skill building services, which are defined as services that offer a type of practice or instruction or other activity aimed at developing skills to assist a juvenile with controlling their behavior. Again, you see 6 service types within this approach. Most of these are relatively self-explanatory, and Sean is going to discuss a few of these in a bit more detail, but I've often been asked, what do you mean when you say challenge programs? And felt it was worthy of just mentioning here today that these are experiential learning activities that teach self-esteem and confidence through the mastering of difficult tasks. Okay, so here's that schematic showing you the service types and approaches once again. After an extensive interview with program staff and review of written materials if necessary, those of us who have been trained in service type classification will ultimately arrive at a specific categorization of your service type. Once again, you can find more information about each of these on the fact sheets. Okay, let's talk a little bit about primary and supplemental services. Programs, as we define them, are a package of services that are delivered by a provider and can include either just primary services alone or primary and supplemental services as well. The primary service is the main service provided by the program. It's the service most characteristic of the program, where most or all kids get this particular service and where the most time and effort is spent. Programs can have more than one primary service, and where this is the case, those services go through the SPEP process individually or separately. Residential programs can have many primary services, which means the SPEP process can sometimes be time-consuming as we attempt to identify all the services happening in the facility and give providers credit for all the good work that they do. Supplemental services are services where not all youth in a program necessarily receive that service. There is less time and effort spent on these, yet they can reinforce or complement a primary service in certain or particular service types. Through the meta-analysis, it was discovered that some services, when paired with other particular service types, showed an enhanced impact on recidivism reduction. An example of this is a mentoring program. When a behavioral management or a contracting service is offered in conjunction with mentoring, it had a more significant or positive effect on recidivism reduction, and thus the program's SPEP score is enhanced to reflect that. The same is true for, say, a challenge program that has a group counseling component identified as the supplementary service. Some services identified as the primary service don't necessarily have a qualifying supplemental service within SPEP. In a family counseling service, for example, there is no qualifying supplemental service. That isn't to say that the SPEP score is negatively impacted, however. If the service is identified as primary and has no qualifying supplemental service, then the score through SPEP is automatically enhanced as if the provider was getting credit, if you will, for having a supplemental service. I hope that's not too confusing for folks. Again, Sean is about to give you some examples on particular service types, but I thought I'd give you a generic example of, to get a sense of what this looks like. If ABC Incorporated is the service provider here, they may operate many different programs. In this example, Circle of Courage is their program that just went through the SPEP process. Once we interviewed Circle of Courage staff, we discovered that there were 2 primary services that were happening in this case, group counseling and MST.
We know that group counseling falls within the counseling therapeutic approach. MST is categorized as a family counseling service within the SPEP, also falling within the counseling therapeutic approach.
Both of these service type categories within SPEP have no quote-unquote qualifying supplemental service. However, that doesn't mean that Circle of Courage isn't providing other ancillary types of service. It just means that none of those other supplemental services are seen as an enhancement to either group counseling or MST within the SPEP process. So what I'm suggesting here is that this schematic could potentially have square boxes underneath the triangles showing supplemental services if either of the primary services had a qualifying supplemental service within SPEP. Okay, I have one final comment I want to make before I hand the mic off to Sean. We know that there are many curriculum-based services available to children, youth, and families, and we know that many developers of these curriculums require that they be delivered with a duration and a number of contact hours that might differ from what Dr. Lipsey set for duration and dosage within the SPEP service types. Dr. Lipsey's amounts of service are based on averages from all the studies within that particular service type that were found to have a positive impact on recidivism reduction. In cases where an evidence-based curriculum goes through the SPEP process, we use the developer's duration and dosage requirements as opposed to the SPEP averages for that particular service type. The general guidelines we use for the SPEP process of an evidence-based service within SPEP is to match that criteria in most cases, not every instance, but in most cases, with the criteria for being considered either a model or a promising program on the Blueprints for Healthy Development website. These programs, often referred to as the Blueprints programs, meet the highest standard of scientific evidence of effectiveness. In case you're unfamiliar with these programs, you can find them at www.blueprintsprogram.com. This is a website that was created through the Center for the Study and Prevention of Violence at the University of Colorado. Okay, thanks so much for your time. I'm going to give the mic now to Sean so he can give you some service type examples.
Good morning. Thank you, Lisa. Our service type examples today are not a comprehensive summary, but a survey or sample of some of the SPEPs that we've experienced within the 5 pilot counties. These examples were highlighted service categories for this particular webinar. Cognitive behavioral therapy is heavily used in our juvenile justice system and found in most treatment programs. An example that we found in a community-based program was aggression replacement training, and it was categorized as a cognitive behavioral therapy program because of the goals that the curriculum itself is intended to address. ART, as you know, uses 3 domains: skill streaming, anger control, and moral reasoning to address the faulty cognitions in youth. And as you see by the definition of CBT, correcting the faulty cognitions or perceptions is the primary identification. Social skills training also has a concern with the youth interactions with others, could be using CBT components to address the cognition itself, but what it does is it highlights on the instruction, the modeling, the practice, and the reinforcement. We found an example in another community-based program which used a leadership curriculum that targeted the communication skills, conflict resolution, and the effective social behavior of the youth. So because that was the emphasis of the leadership curriculum, that program was categorized as a social skills training. Mixed counseling, as Lisa stated, uses a professional, an adult, to influence the youth's thinking and cognition. We found one of these services in a community-based program. It was categorized as a mixed counseling due to the way the service was operationalized. Each youth there received an individual, group, and family counseling session weekly. And topics of counseling were taken from several CBT group curriculums. Then clinical discussions could carry over from one individual session to a family session if needed to address the youth needs. Job-related training is often defined by the development of job-related skills. So the work experience is not restitution-based, it cannot involve normal wages, but it really encourages the youth to improve self-esteem, independence, employability skills, and their marketability. We found an example in a court-operated community-based program where the youth acquired skill development to prepare food, take orders, operate a cash register, and document inventory. Lessons learned so far with our 5 pilot counties have revealed that a majority of the curriculum contains CBT. And although CBT has been identified as having the greatest reduction on recidivism, not all programs that use CBT curriculums will be categorized as a Type 5 service. How the service is delivered or described helps to determine the service classification. Mixing curriculums is a common practice. Social skills training will often use a CBT curriculum to address a youth who are in need of social skill development regarding their decision making. But the social skill curriculum will be used in tandem to address the treatment needs of the youth with a CBT curriculum. So the idea is here that CBT has one of the influences, but there's other things that are being used, and the target and purpose of that service is to develop social skills. Other lessons learned regard the interview process. The SPEP interview process helps to paint the picture of what services look like within the context of the program. Important information is conveyed during this time that helps to sort out the services that kids receive. Having a logic model helps to organize how providers view their services and may even assist in the service categorization. Heather will speak more about the logic model webinars upcoming here momentarily. Other lessons learned involve the language and semantics. They often come into play when a provider is describing their services and how they deliver them. Terms have meaning that is unique to an organization that may require explanation to help others understand. Thorough questions asked during the interview may help the provider to better describe their meaning. There was a training recently facilitated on SPEPing residential services by Dr. Gabrielle Chapman from Vanderbilt University, and a residential program was categorized or unpacked by Dr. Chapman. During this process, we learned how the description of the daily activities told a story of a group process that might have been otherwise overlooked. Often the linkage of services, it will also be explained during this process, and consistent themes will also become very evident as the story is told of what the kid does on a daily basis. Unpacking the multiple service of residential programs takes several hours to ensure that providers receive credit for all that they do. There may be services delivered that do not fit into one of these categories. Although not SPEPable, these services can be discussed in the feedback report that will enable the provider to determine if they want to continue delivering the service the same way, if they want to increase the dosage and duration in order to have a SPEPable service in the future, or maybe to direct their energy in another service and discontinue it altogether.
Okay, this is the conclusion of our presentation piece, and I see that we don't have any questions listed here in the chat box. So if you have any questions that you want to type in, now would be a great time to do that. Otherwise, we're going to try and open it up to Jeff Gregro and see if he has anything to add with regard to service categorization. Jeff, go ahead.
Thanks, Heather. Yep, thank you. Yeah, maybe there are no questions because you guys have just done such a great job of describing the classification process. But just around service classification, I just wanted to stress, and I think Sean just hit on maybe the most important part, is the provider tells the story of their program. This is really a collaborative process, and our thought has always been, who knows a program better than the provider delivering the service? So really the unpacking process is the most important part of this process. We want to get the service classification right, and we really take that seriously. As you guys know, there have been times where we've all gone out and gone through the classification process with a provider, and we've come back to the office to debrief and give our points of view and our opinions on what the service classification is. And those discussions alone could take over an hour just to come sometimes to an agreement. People have different points of view. So it really is, we really take our time doing the service classification and identifying what the primary services are, if there's more than one, and if there's a supplemental service. And because what really makes that part most important is that drives the rest of the SPEP instrument. The duration and the contact hours targets are all based on the type of service classification. So you want to get that right because it really drives the scoring of the rest of the instrument. So I think that I just wanted to really stress how important we take that process and what a collaboration it is with the provider, and how we do unpack a program and sometimes spend hours with a program just unpacking it and getting out all the information we can to have that proper classification. I think a big help too is the pre-visit checklist that is available and that we try to send out to, well, that we do send out to providers prior to coming out for a SPEP visit. There's a lot of work done in advance prior to coming out. on a visit. The pre-visit checklist is given, which pertains to or contains all the information that we like the provider to have available to us, whether it's a daily schedule, program description, any manuals that are used, all that we take into consideration prior to coming out, so it kind of can speed up the interview a little bit. And then just a plug for the website, I think you guys' website contains a lot of great information on the EPISCenter website around SPEP, all the documents that are used, and if we're not going to be able to get out to a provider in the near future, they can look at the website. They can really look at the quality measures piece, which is important, and look at the areas that we'll be looking at in the quality measures, things that they can work on in advance. Is the program manualized, or is there a protocol for delivery? What kind of training does staff receive? What kind of supervision does staff receive while they're delivering the service? So there are a lot of things providers can do in advance prior to coming out for the visit.
Okay, thanks, Jeff. We appreciate that. I apologize. We had a technical difficulty here, so I don't know. Did you answer the 2 questions that were written there?
Oh, I didn't see any questions.
Oh, okay.
I'm sorry, I don't see.
Can you see the one here? It says, if you're using the service type and classification interchangeably, are they the same?
The service type and classification, are they the same? Is that the question?
Yes, correct.
Yeah, yes, the service type or classification is how we describe your program. It's your primary service. So what we'll do during the process is come out and go through the unpacking process and the interview, and then the service type will be your primary service, or the type of service that you're providing. There are 16 different service types that are available. There are 13 main ones, but under the job-related category service type, there are 3 subcategories: vocational counseling, job training, and work experience, and all of those have different targets. So if your program is a job training program, we really need to narrow down then which of the other, a job-related program, then we really need to narrow down what the other 3 are. But yes, your service type will be your primary service that you're offering.
Thanks, Jeff.
And what was the other one, Heather? I can't.
It is there any timetable on SPEPing sex offender programs?
Well, we've been having the discussion with Drs. Lipsy and Chapman, because I know there's a lot of interest not only in the sex offender program but in the drug and alcohol area as well. And the answer that we receive, and the one we received just last week when we all got together with Dr. Chapman, was that it is something that they are currently working on. So I don't have a timeline, and I don't want to throw something out there, but it is something I know that they are currently working on. They know there's a big interest in the state of Pennsylvania, specifically around sex offender and drug and alcohol, what are called special populations, as opposed to the general populations of the juvenile justice area. But I know it's something they are actively working on, and they know that it's something that the state of Pennsylvania is very interested in. So I know I don't have a timeline on that, but I know it's something that they know that we're asking for and that they're working on.
Okay. Jeff, there's another question here. Do fire setters fall into the general population or special population?
Well, the interesting thing that I think we need to stay focused on is, and I don't have an answer, a direct answer for that, but I think we need to look at the type of service that is being provided, and not the kids when we're looking to identify a primary service. So we'd have to look at what kind of programs or service types are going on within the fire setter program. So if there's individual counseling or group counseling, or whether there's any kind of CBT programming, or there could be a challenge type programming, I think that that's something that we could look at. If you have a fire setter program, it's something that we can look at the types of services that they're offering kids. Another, I think, great aspect of the state of Pennsylvania's commitment to this project is, even though the pilot with Vanderbilt around the Juvenile Justice System Improvement Project is ending at the end of December, the state of Pennsylvania is going to continue to contract with Drs. Lipsy and Chapman from Vanderbilt to continue to get answers on these questions as they come up. Pennsylvania is still a pilot in this process, as are the other states that started. There are 3 new states coming on board that are going to look to Pennsylvania for lessons learned. So as we continue to extend our involvement with the people from Vanderbilt, we will be able to answer these questions. But I would just say with a fire setter program, I have not heard that it's not part of the general population program. So I think that's something we could look at, what types of services are being provided within that type of setting.
Great.
That's a good
Jeff,
question.
thank you.
That's a good question, and one that we really...
And Jeff, I don't see any more questions here. This about wraps up our webinar. I'd like to note that we have a 4th webinar scheduled for January 24th at 11 a.m. This webinar will focus on logic models. Logic models can help providers clearly communicate the services they offer and how they are expected to influence youth behavior and outcomes. Logic models can also be helpful for directing provider activities and to help provide some structure for the SPEP interview. More information on webinar 4 will be forthcoming. Should you need additional information with regard to the SPEP process, I'd like to invite you to visit our website here listed below. Finally, we would appreciate you completing the webinar evaluation. It's located here at the bottom of the screen under webinar evaluation. Evaluations are used for ideas for future webinars, and we also use them for professional development as well. Thank you everyone for joining us, and have a great day.